Going to get started then. So welcome and thank you for everybody joining us on our Tech for Good chat today around health and wellness and some of the huge advancements in this area. As you've probably seen since the pandemic, I feel like in this space there has been a massive change in the health and wellness sector, from the NHS are now allowing you to book appointments online, to being able to use apps to look for prescriptions and be able to talk to a doctor about prescription there and then. I think it's very, very fair to say there has been some massive changes in the technology world around health and wellness. I think we've also really seen some great movement, not just in health, but also that wellness space as well, helping people with their physical health and also their mental health. So it'd be really, really good to hear about some thoughts and feelings around these areas later today. So today we are joined with an amazing panelists who we will do some introductions with a little later. And when we do get into the panel discussion, please ask us lots and lots of questions. We are here to answer them today. The panel is prepped and ready to go, and you'll be able to pop your questions in the Q&A section of this platform. So yeah, as I go through this, if you've got some questions already prepped, like I normally do, please feel free to start popping them in nice and early, and yeah, we can get those answered for you. So just to kind of cover off the agenda today, so we'll be starting off from a little bit from me and talking a bit about Three-Sided Cube, why we're here, what we're all about, and our expertise before diving into the panel. So to start with, I want to introduce myself. So my name is Emma. I am a Client Success Director here at Three-Sided Cube. I've been at Cube about 5 years. I actually am on the US side now. I moved my life over here with Cube at the end of last year. So I have been servicing the US side of the business, looking and helping our clients with their long-term strategies around platform and supporting them with achieving their missions in the technology sector. So who are Three-Sided Cube? So we are a software development agency. We specialize in software development, particularly mobile apps and digital platforms. However, we are a mission-led company, and our mission is to change millions and millions of lives for the better. And how are we going to do that? By working with like-minded organizations such as our panel and probably some of you on this event today to build tech for good, because technology is now such a super powerful tool and it's something that is intertwined in our daily lives. However, technology can be agnostic, and particularly when it comes to the health and wellness space, I think it's quite fair to say that there are like quite a few platforms out there that probably hinder the health and wellness, particularly around wellness, with the amount of how you can get involved with technology these days, the type of things that can be shared around health and wellness. And you need to make sure that that information's right, to make sure that you are really, really helping those people out there and changing those lives for better. So that's why here at Three-Sided Cube, we want to make sure that we're working with very particular types of organizations who are really striving to do good in the world and have a real positive impact on people's lives. So before I hand over to the panel so we can start talking and answering your questions, I just wanted to quickly cover a few of our lovely organizations that we work with and the type of work that we've been doing with them to help change millions of lives for the better. So first of all, the American Red Cross. So we have been working with the American Red Cross for over 10 years now. And over that time, we have seen such an evolvement of this platform. It started out being a very simple app with emergency content to really help users, when in an emergency, get to first aid content as quickly as possible. Because when you're out and about in a forest or anything like that, in terms of hiking or anything, trying to get to first aid content when it matters can be really, really important. It can be life or death sometimes as well. So we wanted to make sure that there was a tool out there that could really help users get to that as quickly as possible to ensure that they can help when it matters. A great thing around the first aid app as well is, and what we've learned across the last couple of years, is that people want to digest content as quickly as possible. Like everyone is on the move, they're raring to go. Like to be able to read and digest big long bits of content is just not a thing anymore. So we've really had to think about how can we help users digest content quickly and when it matters. And the ways that we've done that with the first aid app is looked at gamification. So some of the examples of that are having quizzes so that we can actually quiz them on their knowledge around first aid, but also looking at other ways that we can kind of get them engaged with content such as scenarios. So actually putting like them in a live action of moment of like, okay, here's a scenario of like someone has stopped breathing. What are the steps to do next? And getting them to really think on the spot, because when you are in an emergency, you really do have to think on the spot. So it's really learning from user behaviors to how we can actually get them to engage and digest this content and keep it at the forefront of their mind. So then just moving on to our next case study. So the British Red Cross and the Baby and Child First Aid app. Again, this is very similar to the American Red Cross app, except for it's very, very focused on the baby and child first aid, because I'm sure there's quite a few of you out there who are parents, and the amount of stuff you probably look up online on Google when something happens, from coughing to bleeding, with any type of thing with kids, you're like, want that information as quickly as possible. So the British Red Cross app really allows you to kind of get that information at the snap of a hand, and once basically allows you to get that information when it's an emergency, but also quiz you to make sure that you're informed and you build your knowledge about how you can take care of your child in those emergencies as well. And then finally, just going on to the last case study before I stop wittering on and hand you over to the panel. So this is the American Red Cross blood donor app. So the aim of this app is to initially help users book appointments to donate blood. And over time, we have seen over 200,000 appointments booked on a monthly basis, which is amazing. But as you probably remember way back into the pandemic, if anyone remembers that as a distant memory or likes to block it out of their mind like I do, there was a real need to understand people's health stats, particularly around COVID, and if you were positive or negative. And one of the big updates we did in that time, and we had to move very, very quickly with this, was to allow users who were donating blood to be tested to whether they were positive and negative in COVID. And that really, really helped users, and obviously helped us really understand, like, okay, who is actually got COVID and who hasn't. And one of the things that kind of evolved out of that particular piece was how important and how much users really, really wanted to know more about their health stats and be basically on top of their well-being. So one of the other things that we recently added into the blood donor app was actually having health charts. So every time a user looked to kind of donate blood, they could also track their blood pressure, their hemoglobin levels, and their plasma units as well. So they can keep on track and making sure that they are staying very, very healthy. And that has been quite a successful new feature that we've added into the blood donor app recently that users have been really, really happy with. So that is also awesome. So that is enough from me. Now I would love to hand over to the panel, and I'm going to hand over to my equivalent in the UK, Rest of World, Bina, who's also a Client Success Director, who is going to be basically digging in and asking those questions. So again, just as a reminder, as I did at the beginning of this event, please add lots of questions into the Q&A piece, and we'll get to them as quickly as possible, and hope you enjoy the rest of the event.
Amazing. Thank you, Emma. Thank you for handing over to me. And you totally stole my one line, which was about the question and answers. So thanks for doing that. But yeah, as Emma said, please put in your questions and I'll field them out to the panelists either at the end or during the sessions. And yeah, really great and excited to hear from everyone today. I'll give a quick introduction to who's on the panel, and then I'll hand over to them to give a bit more of an introduction to themselves. So I'll start off with, we've got William Spencer from the British Red Cross. Then we've got Ariana Vargas from Stigma, Alessandra Wedrich from Planned Parenthood, Dr. Daniel Grace from the Virtual Doctors, and Dr. Isabel Windermer from also the Virtual Doctors. So really excited to have you all here today. Thank you for joining us. And I'll hand over to you to do a quick introduction about yourself. And then I know everyone's really excited to get into the panel discussion. So, Alessandra, I can see you first, and the other William and Dr. Daniel, if you want to turn on your cameras as well. But Alessandra, we can start with you.
Sure. So I'm Alessandra. I also go by Ali for whichever is easier. And I'm an Agile coach. For those who may not be familiar with that term, what that means is that I essentially cultivate rockstar high-performing teams, making sure that they center the user or the patient in all the things that they build, and that we're able to change and pivot as the world changes. And the most recent organization that I was with was Planned Parenthood, and I worked there for about 5 years.
Amazing, thank you. We go over to Ariana.
Hello, my name is Ariana Vargas. I am the founder and CEO of Stigma. I was born in Costa Rica to a father with schizophrenia, so I have a lived experience of understanding stigma really well. And as a filmmaker, wanted to contribute stories to the world that would help people understand misunderstood conditions, and ended up getting a really big response to a short film I did about PTSD, showing it from the perspective not of a combat veteran, but of a child who had been through pretty horrific abuse, and showing what impact that can have on people. That led me to building an app where people could find people who share their lived experience, ask for hope on demand via asynchronous text, audio, and video. And we launched it in August of last year, and we're just named by Google as 2022's best app for good.
Wow, that's amazing. Congratulations.
Thank you.
And Dr. Daniel Grace?
Hi, hello, my name's Daniel. I'm a GP by background, but I'm here today in the capacity of the Virtual Doctors Medical Director. So along with Isabel, who will introduce herself in a minute, we're part of the Virtual Doctors team. So it's a charity that supports rural health centres in Zambia and Malawi, providing them with remote telemedical advice and connecting them to NHS volunteer doctors here in the UK.
Fantastic, thank you so much. And William, over to you.
Hello, hiya. So I'm from the British Red Cross. I've got a weird job title, so product manager of the Disasters and Emergencies Squad in community education. So I look after all our first aid training and education, the free side, helping the vulnerable and most at need with education. And beyond first aid, I look after climate resources as well. But we have an app through StudyQ.
Fantastic, thank you so much. And last but not least, Dr. Isabel Windermere. I think you're on mute at the moment, actually.
Okay,
Yes.
perfect. I can still see William when I'm looking at the screen, so it's a bit disconcerting, but hello. I am Isabel. Like Daniel, I'm with the Virtual Doctors. I'm on the Board of Trustees. In my other life, I'm a consultant and coach, but today I'm here for the work with the Virtual Doctors. And I have a background as a physician and as a researcher, and I've been active in the healthcare space since studying. And I'm very passionate about getting patients access to healthcare, and we're going to be talking about that today. And I think it's the only way is virtual, looking at the way the world's going. So I'm excited to be here today. Thank you for inviting me.
Thank you so much. And yeah, really excited to hear everyone's thoughts and experience in this area. And without any ado, we jump straight in. So the first question, what are some of the changes you have seen in digital health and wellness care in the last 5 years? For anyone who wants to start off.
I don't mind starting, seeing as otherwise there's an awkward silence. I guess the main change as an NHS GP in that capacity was the way that during the pandemic we went from telehealth being something that was kind of thought about but not really done. It was sort of mainly left to private companies like Babylon and other such companies, but then sort of overnight, as everyone had to isolate, telehealth became sort of everywhere really, which I think is a good thing. I think it's really exciting. Sort of with the Virtual Doctors, we've been doing this sort of thing for quite a while now, linking sort of Africa and the UK. So it was sort of strange to see it coming to the UK and sort of to Western healthcare, but obviously in a slightly different way. And yeah, the sort of from there, I think there's a lot of exciting tech in terms of patient monitoring, portable ultrasounds and using telemedicine to look at those. So many different devices now that we can theoretically use our smartphone cameras, can't we? And they can just look at us and tell us what our respiratory rate is, how quickly we're breathing, put our finger on them, and they theoretically at least tell you a correct pulse and oxygen level. So I think there's a bit of cynicism there, because I think that's one of the important things, certainly from my perspective, is that yes, there's lots of really cool tech. Some of it is really good, but the regulation of it is, and with telemedicine in general and health tech, it's all sort of still in this, I think because it's advanced so quickly, sort of exponentially almost, that the regulation is maybe playing catch up, but it's, a lot of interesting things.
Amazing, thank you so much. It's really great to hear how that's really grown and how it's accelerated through COVID in the recent years. Ariana, do you have anything to kind of add to that?
I'm glad that you called on me, because I did want to call out, I may be one of the few non-medical people or sort of don't have a clinical background. And I think that's something worth calling out, because that is a change that I've seen as it relates to how we support people in their mental health. So a lot of people subscribe to Dr. Thomas Insel, the former head of the NIMH in the United States, his perspective that mental illness is a medical condition that requires a social solution. And so I think what we're seeing is the idea of people reconsidering what it means to support your mental health, that it won't always look the same for everyone. So it's not always about an SSRI or talking to a therapist or counselor. Sometimes it's about social connection to give you that people, place, and purpose. And so I feel like what we're seeing a lot of in the mental health space is people trying to figure out, how do you address loneliness? How do you address giving people spaces to talk through and process trauma that are safe, that aren't always clinical, but can have a really positive impact in helping people activate and supporting their mental health earlier in the mental health care continuum, so that they don't reach the level of crisis and we don't see higher suicide rates, and we don't see the cost to the medical system where people are ending up in an ER that's not well equipped to handle them when they're in a moment of crisis.
Fantastic, thank you for sharing that. That's a really interesting to hear a different perspective in that regard. And William, Isabel, please just jump in.
I do. I actually have some observations, because the question is the last 5 years, and I think depending on which country you're looking at, the evolution is very different. So if I'm looking at Switzerland, where I'm based now, the first telemedicine provider I saw was 2003. And that was because the insurance providers were realizing it was cheaper to send people through a telemedicine service, and so they became gatekeepers for the health community. And so I think there's a big difference in countries and in adoption. And one of the biggest drivers I've seen, I think it's a common one, is the cost implications, but also, of course, access to healthcare providers, which is what we provide through the virtual doctors in Malawi and Zambia. But also, if I'm looking at the demographic development of Europe, there's more and more old people, there's less and less, there's not enough healthcare professionals. We take a lot of healthcare professionals from other countries. So basically, there's not enough providers anywhere anymore. So I think that beyond the cost aspect, the only way that we will be able to provide access to healthcare is by providing virtual solutions that are in some ways like what we do with our charity, potentially international or across geographies. So it's a very interesting time.
Fantastic.
Just kind of going on to that, because obviously you've talked about in the last 5 years, and also like different countries obviously evolving with technology in the health and wellness sector in a very different way. And as someone who has obviously lived in the UK all her life, had the NHS, and being able to known the process of being able to get healthcare in the UK, to moving to America, where the healthcare system is very, very different, and there's a big learning curve as a user. Like, I found really like the kind of technical involvement and things that really helped me when I first moved over here was actually like, for small prescriptions, being able to access it online through kind of like funneling of questions, and being able just to speak to someone who have never, a doctor as quickly as possible, like within 24 hours, and having that prescription in my hands 24 hours later. Like the speed of getting that prescription from just saying, okay, yeah, I need help with X, to why, like back when like in the UK, having to visit a doctor in person and then going to a pharmacy to get it would take, could take up to like a week. So I feel like in this space, like one of the things is the speed that we can actually get to people using technology sometimes as well. And that has been where I've had to learn about like, healthcare plans over here, and in that like kind of middle time of like getting that set up, being able to access someone like over the phone, over technology, like within an app, to kind of say, I need a prescription for this. Can you validate this? Great, let's go. I think has been super, super useful from an end user perspective. So that's just thinking about different countries and how we handle different technology. Like, we aren't all in the same space, and we need to, there is ways of like, how is technology advancing in different areas of the world?
And also, I can imagine it's a game changer for families and parents, etc. Ali, have you kind of had some good feedback from parents and families around kind of accessibility, etc.? Are you able to hear us, Ali?
Sorry, I thought I heard something about Planned Parenthood in there, but I missed the question.
I was saying, just like the accessibility to the digital tools now must be quite a big game changer for parents and families, etc. Just wondering your experience and your feedback kind of in this space.
Oh, yeah. So, I mean, in addition to telemedicine, I think we've seen an abundance of apps around health and welfare, wearable tech, and an increase in like AI-driven solutions, in addition to sort of like the users or patients creating their own communities, exchanging information about symptoms that they're experiencing, realizing comorbidities that they might be having. And I think the combination of this for sure helps improve accessibility to some extent for people who are tech savvy, who know how to navigate those systems. At the same time, it can create some barriers for people who might not be as tech savvy. And I think something else that I've noticed is, and I think Emma touched on this, is that as all of our different countries and states are working to kind of create this regulation and try and figure things out, I feel like healthcare has become more and more of a political issue. And that has also sort of informed what we can do and how we do it.
Yeah, absolutely. I think sometimes we forget about these outside influences that also shape and evolve technologies in this sector. William, have you got anything to kind of add in this your thoughts on the changes?
The world's unrecognisable, isn't it? And what a shame it took a pandemic and a war to change it. But in terms of just educating people about first aid, we have a team of people that go around the country teaching kids and adults first aid using a kind of everyday approach. And obviously the changes involved through the pandemic, teaching virtually, a massive change. It allowed us to reach many, many more people. Using the apps that you've created for us, absolutely, that kind of remote learning, that new recent zeitgeist for kind of more snackable content that we provide in the apps. Very interesting to see the figures you had up for the American Red Cross first aid app as well, because they're on 1.2 million and we're just about to hit 1 million. So if anyone's out there and fancies scanning that QR code behind me, we could perhaps overtake them. But the point is, people need virtual access to these kind of learning platforms. So we've also created first aid champions to help children learn first aid. It's on the curriculum. So we're using tech in a good way just to reach and teach far more people. But the point about digital exclusion is really key as well, and it's our remit is to reach the hard to reach, the most vulnerable, the least resourced, and we still need the army of educators out on the field to actually really go into those need areas, because they simply don't have the tech that we all do.
Yeah, absolutely. Thank you. And then, audience, please do put any questions you have in the question box on your screen, and the panelists will be happy to answer them. In the meantime, I just want to, we've obviously seen how it started and how it's progressed so far in terms of the technology, but how do you think virtual care will continue to evolve in your eyes? And I can imagine there's lots of different levels and places which you're at the moment. But yeah, great to hear where you think it's going for the future.
I think the thing that's pretty hard to ignore is ChatGPT and its mates, you know, the other various iterations of it. I mean, it's amazing, but also terrifying what AI can do. And this is just the start, isn't it? Like, I was showing someone ChatGPT the other day, and I was like, look, I can get it to write a patient information leaflet about head injuries. And they're like, no, it won't do that. And then it writes it in real time, doesn't it? And you think, okay, it's amazing, and it's super useful, don't get me wrong, but it's also it's an interesting box, isn't it? Is it Pandora's box that we're opening? I suppose time will tell. But I think, yeah, machine learning is going to be a huge benefit. I think we just have to be careful in how we embrace that and what it can do. I know Babylon, a few years back now, might have even been pre-pandemic, I think they launched an AI part of their app, which was supposed to determine more or less what was wrong with you. So if you put short of breath and chest pain, it would say, you know, it would go down a whole different algorithm and tell you what was going on. And I think it missed quite a few red flags and potentially could go the wrong way. But, you know, time has passed, and I'm sure it'll be more accurate now. But it's what they can come up with is really clever. And if you just look at improving access to healthcare, so NHS 111, for example, at the moment, if you ring up, for those of you in the US, it's the NHS's sort of triage patient access pathway. You put in the phone number, the call handler will answer it, go through loads of questions. But I mean, it's a good source of employment, but AI can probably do that. And it may be able to do it better with time. And if you think of the wealth of data in some of these clinical systems, you know, with machine learning, that can get better and better. I guess one of the concerns and buzzwords in there is data, though, isn't it? And like who owns our data? And I think that's probably, I mean, we can touch on it a bit later, maybe in one of the challenges. I know that's a later question, but I think data integrity and ownership and security is one of the big things. But yeah, I think machine learning. There's some really interesting examples. They're now starting with breast cancer screening. So you'd normally have your mammogram, and then you'd get 2 radiology consultants would look at the pictures to verify that the first one has actually interpreted it correctly. Now that second doctor is a computer in some areas, they're certainly trialing it. Yeah, you can look at some of the AI it's passed the licensing exam in the States, I think, now the US LME. So I think there's some exciting stuff with machine learning. I'll stop rabbiting. I could talk for ages, but I'll let someone else say something.
It's about trust, isn't it? And if medical advice doesn't come from a trusted source, it's good grief. And it will no doubt get better than the human, but for now, be very, very careful. I think AI used in the right places for targeting education, for targeting and finding certain cohorts, brilliant. But be very careful with medical advice. We did an experiment with an AI narrator for some videos, some translated videos, and it was good. It wasn't human. It was good, but it just didn't feel right. It just didn't feel right. Certainly from a humanitarian organisation, it just didn't look and feel right.
It's the not knowing how it's making its decisions and where it's getting its ideas from. I think it's just a bit unnerving, isn't it?
I think, yeah, that's for me, like, where you can search for anything these days and like look it up, and like it is being really clear, like if you are being given that content back from machine learning or AI, like is it the right stuff, like, and also who is kind of regulating it as well, because, you know, it only takes like a miscommunication on something, like from like triaging something in an emergency to, you know, be in a potential emergency situation. So it's like, how do we make sure that users are like using it as maybe a secondary tool initially where the clinical stuff's not there, but needing to know that, you know, it does need to be confirmed by a kind of expert in that area, like that we still need, I think, particularly with health and wellness, like the experts need to be, and it needs to be kind of regulated. And it's just, how do you do that? I guess that would be one of the challenges we potentially talk about like later on as well.
Well, there's another aspect to it too, isn't it? It's AI is always like Mary Poppins somehow. People go, why can't I just put AI on it? And it's it takes months to train. It takes, clean data sets. It needs to make sure that, I don't know if as all of us, I've asked ChatGPT questions such as, what is God's phone number? And at the bottom, it said to me, you must respect everybody equally and everybody's belief system equally. And I'm thinking, okay, so I'm getting a mantra plus sort of somebody's ethical considerations on top of the response, which I find quite very, very concerning, because depending on who programmed the AI and what it's been trained on, that bias will be very different. And so those are things that need to be addressed. And data sets, we'll talk about this later about the challenges, but data sets in clinics, the taxonomy is different, the ontology is different, the way people structure their data is different, the way people put it into data sets is different, and the systems are all not speaking to each other. So just putting AI on top of that and saying, tell me what I do with a breast cancer patient, I think it's putting the horse in front of the cart or behind the cart, and actually maybe you need to tidy up the cart first. I know that sounds very negative and totally not pro-AI, and I'm not anti-AI, but it's just, it's not a magic wand like pretty much nothing is, even if we'd like it to be. I think
still in that middle area, isn't it? It's like it can be used for good. So like we talked earlier on about tech is agnostic. It could be used for good and it could work really, really well. But there's a lot of regulation and like consideration that's needed for it to make sure that it does stay in that kind of good space.
Well, I think it's also knowing where to use it, right? So I have a colleague who used to work in Rolls-Royce, and they used it to check engines. And I love this story because he said they used to have engineers saying, is the plane ready to fly? Can this engine take off? And the engineers would check it and they would make a yay or nay decision. And then they brought in AI to do that, because there's so many parameters to look at that it's almost impossible for a human to look through all of them. And the engineers are very unhappy about it. And AI said, okay, this engine can't take off. The plane shouldn't take off. The engineers overrode it, and the engine burnt out. I mean, and then what they did to convince people, they said, okay, we're going to run the engineers against the AI and see what percentage, how well they do. And I think the engineers were sort of 95% and AI was 98. But it took a while for people to say, okay, actually, it's for this specific situation, it outperforms us. And there are situations where it will outperform us. I'm wondering, sort of in the mental health space, where people have, and you look at, I don't know, or any other space where things are not clear, like an MS patient, they have good days, bad days, things are different. It's very hard to go, I'm looking at this and this is it, and it's the same for everybody. And at that point, humans are already not very good, because we like to put things in boxes and put a little stamp on it and say, this is what's going to happen, and that's terrible for the people who are patients. AI might be better, but it's only programmed by humans, right? It's programmed by humans on human data. So if you've got a bad bias in a system, you might be making that even worse.
Yeah.
Unless you're really, really aware of it. And it's hard to be aware of our inherent biases, isn't it? That's why it's an inherent bias. So those are my considerations, which are not all positive. I would love to be all positive. Sorry.
Good to hear two sides of the coin, though. We need to kind of be, I think, open and honest about these things and hear about it. But I mean, Ariana, great question about the kind of mental health situation. Any kind of views on that?
So many. I'm so excited. So our company is, the tagline for Stigma is crowdsourcing hope. So count on me to be optimistic about things. I'm in the same camp with almost everyone about the risks of AI, but I think sometimes we forget that a hybrid is probably always what will be, not always, but what will be the scenario for a very long time, as it should be. So we have already implemented AI that we have trained ourselves, and it does take a while, and we don't have a data set large enough to build our own machine learning model. But when you look at why people come to Stigma, people are coming because they're in pain. So they're saying, I got laid off. My wife wants to see other people. I lost a child. I don't feel attractive. I fell off the wagon of sobriety. I mean, it's the range of human emotions that happen, and they're saying, I need some help. So we looked at how long does it take people on average to get a kind message of support from a stranger, and it was way too long. Some people were getting them in 30 minutes, some were getting them in 2 minutes, and some went forever. Some people have asked for hope on our platform and never gotten a response because they have such a unique lived experience that there was no one in our, still growing community. We only launched in August, and we realized that if people are coming here to get some support, how can we use technology to facilitate them getting that support sooner? So we took GPT-4 and we trained it on the hundreds of messages of hope that we had gotten in the community so far. We trained it on days worth of interviews. So I've interviewed 200 people in the last 2 years about their mental health. And what we can do with those data sets in the future is look at how do people talk about their experience when they're living with bipolar disorder versus when they're living with major depressive disorder. And to be clear, this is not me who will be making the assessments. It will be, clinicians and people with degrees and licenses, but always supplementing AI. So I think that if we think of AI as providing the solution, the diagnosis, the answer, that's very dangerous. But if it informs the solution or the diagnosis or the answer, then I think that's where there's a real power to create efficiencies and speed, which can be really meaningful for people who have fast progressing medical illnesses, for people who are reaching a level of crisis with their mental health. So now what happens is if someone goes and asks for hope on our app, AI instantly generates an offer of hope. However, just like with human messages on our platform, where we moderate every single message to protect the psychological safety of the people who are engaging, we moderate the AI messages. And we've never gotten one that's dangerous. There's no drift, there's no hallucination because it's relatively short. We limited the character amount of what can be said. But what we asked it to do was respond in a way that's taking inputs and using words from the ask and putting it in the answer. And what that does is, like, if anyone's ever been on hold for customer service, like you're on hold forever, you finally get to talk to the person, and if they just recite a script back to you, it is the most enraging experience in the world. And that's with a human being. So we don't want to do that with AI. And what makes you feel seen and heard is when someone repeats back to you some of what you've shared. And so what we're doing is training our own model. It will take a tremendous amount of time for this to be the kind of data model that would be meaningful to like apply to other businesses. But in the interim, what it's doing is it's helping people get support right away. So when someone sends a message and they have a unique experience, or even if it's not that unique, but we're a small community and there just aren't people active in that moment, we send it and we're very transparent and say, this is Stigma's AI Hope Bot. It's called Ally. It's not a human being. We're sending this so you can have some kind words and some peace right now while we wait for real members of the community to offer you support. The engineer who built it surprised me a few weeks ago and said, hey, this is it, but now I cloned your voice. And at first I was like, that is so creepy. I don't think I want to do that. But then I worked in brand for a long time, and I think about people know what Siri's voice sounds like. They know what Alexa's voice sounds like. And the idea of being able to say, we're not pretending this is a real human being. We're telling you that this is our AI, but would it feel more hopeful to someone? Would they feel more seen and heard if it was an audio offer of hope? So I do think, in that way, and then also in understanding how people communicate about mental health. We know that the average amount of time between when someone starts to struggle with their mental health and they first seek treatment is 11 years, because asking for help is hard. It is hard for everyone, and it's not just about mental health. Any kind of support you need, it could be a hard thing to do. And so if we can use AI, building recommendation engines, like you go on Amazon and you buy a mop and it says, because you bought this mop, you might want these floor cleaners. Other people have bought these things. If we can do that same thing with resources, if we can use AI to help inform care coordination, I think that's one of the more exciting ways we can apply it in the mental health, medical health, and wellness spaces, because care coordination requires knowing a person. And if a person doesn't want to volunteer to speak to another human being about the things they're struggling with, you don't get that information. But if someone has a private space where they can ask for hope that's anonymous via text or audio or video, or work in some of the new features we're building to share the things that they're really struggling with, your ability to understand resources that might be meaningful to them, it just expands exponentially. It can happen faster. And so I think there is a huge opportunity with AI, but I just can't imagine a future anytime soon where AI technology isn't and shouldn't be coupled with clinician oversight, medical oversight. So
just to that point as well, I think it might be one of the challenges that we talk about is like, health and wellness is very personal, like very, very personal to you. And there's an element of like, when it is personal, being able to talk to a human being about it versus technology. And I think it'd be really interesting to understand that as a challenge of like, as technology evolves and as technology kind of takes over the world in a way, and it replaces potentially some of that human interaction you would have, like, is there a challenge there of kind of like, because to your point, you said that there was always still that human interaction behind it, but there's so much technology out there where it's replacing that human interaction. And is that going to hinder some of that kind of personal kind of like relationships that you do have with like your doctors or anything, so where you do feel like you can open up more versus just not feeling that there's that empathy or that kind of that side of things at the end of technology. So it'd be good to kind of touch upon that a little bit, I think, and the challenges a little bit later.
I'll just add something. Like, this is a really interesting discussion, right? It's interesting because we have this bias that humans are going to be nice and an AI is not going to be nice. And there was an interesting study done by somebody looking at responses that clinicians give versus responses AI give. And if you look at the reality of most physicians nowadays, I mean, I stopped practicing years ago, but even then it was a 24/7 job, and you are always running from one patient to the next. And while you're running from one patient to the next, you're getting a phone call about something you forgot somewhere else or you should do. And so your brain is all over the place. I mean, maybe it's just my brain, but I don't think so.
That's really true, isn't it? Like, AI doesn't get hungry. It doesn't need to rush to the toilet when it actually needs to see another patient.
Daniel, tell me more. Right. So I think there's a really nice video sequence of Sophia, the humanoid robot. I don't know if anybody's seen it. Developed by Hanson Technology in Hong Kong, and it's this beautiful sequence because it's a very cute looking robot. It's blonde with a cute little face, but the back, it's all the wires, so you can see it's a robot. And they used it to interview patients. And what was really fascinating was during this, I mean, the patients obviously knew they're being videoed and everything, so it was all ethical, but it was just interesting because you could see as they talked to this robot, how some of them relaxed, and you could see that it became almost it was like a human interaction. They were talking to somebody who was listening to them, and the robot's very good, so it was very good at answering questions and asking. So you sounds like you're a little sad right now, Daniel. Would you like to tell me more? And you forget it's a robot. And so I'm thinking, as we see physicians, there's less and less of them. They have more and more paperwork. Nobody seems to be able to solve that right now. Daniel, if I'm talking things that are no longer relevant because they've all been solved, please tell me.
No, there's not enough healthcare professionals in general, are there? I think, and it's like that what we said at the start, it's access, isn't it? Instant access. Instagram, we can go on Amazon, it will come the next day, we can do our supermarket shopping, it will arrive. But with healthcare, that's quite different. So I think if we can improve access with AI, you can access them 24/7, can't you, potentially? And if it can, well, from the mental health side of things, if it can prevent or manage a crisis temporarily whilst psychiatrists can get involved or something similar, then that can only be a good thing.
It might even be useful for doing a proper diagnostic interaction with the patient, because I mean, a patient sometimes, I've been with my mum to ER, I don't know how many times. My mum is not a healthcare professional, I am. And the healthcare professionals are generally stressed because they've got 4-hour waiting lists in the ER and they've got a lot to do. So they haven't got time to ask somebody who's 81 lots and lots of questions to try and find the nugget of truth within all that data that a patient might think is relevant, but actually medically isn't. So I don't know whether there is a space to have a pre-screening conversation. If you're sitting in ER for 4 hours, maybe you prefer to talk to an AI that goes, so tell me what happened exactly, and you can have a 4-hour conversation. It keeps you busy, you're not frustrated, maybe your pain's mitigated, and then the doctor can look through that and have another conversation, but maybe zoom in faster. So I think there's a lot of potential there that would potentially also support people from a human level. And if you're doing, I don't know, electrocardiogram diagnostics, I'm pretty sure an AI can do better than a human because that's binary. Those are numbers that can screen that very fast. The other things I think you need both. Oh, and my other robot, which I really like, is Paro the therapeutic robot. Have you come across that one? It's this cute little baby seal that's used in dementia patients. And so dementia patients who are disoriented, they're worried, they're scared, they're given this little robot and it purrs at them and it makes them, and it calms them down. So I think there's in that space, even on wards where there's not enough staff, maybe having a little robotic AI thing driving around. I think that exists already, that says, how are you doing today? Do you need anybody? And that's trained to monitor immediate need for a patient. There's lots of areas where it could do loads of good.
Yeah, on the topic of dementia patients or patients who are bedbound with cognitive impairment or otherwise, I went to an interesting conference in Birmingham, probably pre-pandemic, but they were very keen on the virtual reality, like the Oculus headsets and things like that. So someone who is bedbound for whatever reason, or they just want to experience the world, whether that's a real world or a fantasy world. You can put on the 360 headset, and someone who is palliative but maybe wants to see where they used to go for walks in the woodland where they grew up or something, you can do that. It's quite interesting. And then there's another app that I heard about actually just yesterday. I was having a discussion with some people in Wales. It's not a Welsh app, but they it's kind of a mixture of AI, machine learning, and the reason I'm mentioning it is it's because it's linked to either patients with cognitive impairment, communication issues, or children, particularly sort of young children who may not yet be talking, and they've analysed the facial expressions of people at varying levels of pain. And normal facial expressions, you know how that you can get them all the little dots that kind of map to the face. And then if you think someone's in pain but you're not really sure, you can point the phone at them and it will map their face and it will say, no, statistically this is a normal facial expression, or actually, yeah, in a child that's 18 months, this facial expression is more consistent with pain, which I thought was fascinating. I've not sort of had more than a 5-minute kind of conversation about it, but there's really interesting stuff going on.
Yeah.
So I want to take us back a moment to what was brought up earlier in terms of AI versus humans and how they interact with patients, because at Planned Parenthood, we have both a chat bot as well as a chat text team of humans that interact with users on our site. And it's been interesting to sort of different approaches that users bring to each. We saw a lot of people bringing sort of like more embarrassing questions, like, is my body normal? Is this normal? Is that normal? To our bot, things that they felt like they might be judged if they asked another. And then we saw them, if they needed more information, if they needed that human aspect to their answers, the bot could redirect them, or they could just directly access our chat tech team and talk to a human and have those deeper conversations about maybe symptoms that they were experiencing, or what they should do for their next steps, or generate a care plan. So it's been sort of fascinating to see how different users show up to these different ways of interfacing with advice or healthcare, and just kind of getting that validation. And I love the direction this is going in terms of like looking beyond AI, because I know AI is like the bright shining thing that we're all seeing. It's in the news a lot. And it's also a tool that we're still figuring out exactly how it works, what its limitations are, and how best to utilize it. And there's so much other tech out there. There is VR, there is AR, there's lots of applications for that. There's lots of wearable tech that can help us with long-term diagnoses and monitoring, therapies. There's EMR integrations, so like your electronic medical record, like how might some of these new technologies integrate with that or not integrate with that? What are the boundaries there? There's all kinds of new things happening on the technology front.
I love the enthusiasm. Thank you for sharing the story with the bots and the human interactions. I find that really, really interesting and very easy to understand. It's the same thing as looking on Google for symptoms that might be embarrassing, rather than calling your friendly neighborhood doctor in the hope that you can auto-diagnose and then treat yourself without telling anybody.
Yeah, absolutely.
Yeah.
And we have touched on the challenges of like making sure about safeguarding in place and being transparent about using AI to your end users, etc. Dr. Grace, I know you wanted to perhaps expand on some of those challenges in this area, in particular with regards to data. So yeah, just putting out the question with regards to challenges in this area and the impacts of that.
Yeah, I suppose the data thing is just who owns your data, and do you trust them? And like to an extent, you kind of don't have much choice. I think at the moment you either pick Amazon, Google, Apple, probably. I know Google, there's probably a few others, but Google probably knows everything about me because I've got a Google phone, I've got this, I've got that. I think they don't know anything about my health, but I don't know. Because, there was the Google DeepMind that was in hot water about, I think it's been in the US and in the UK about sort of analyzing patient data, and then how much of the data is actually taken by Google, what they're actually looking at. I think it's just a lack of regulation, isn't it? And then it's also a case of, as you know, if we're looking at online and the internet, it's an international thing, isn't it? And we have a similar questions that we have to ask ourselves in the virtual doctors, because we are based in the UK. The patients and the clinicians that we give advice to are based in Zambia and Malawi. So it's their data. Where does it get stored? And there's no right or wrong answers. Sometimes if you're providing services to low and middle income countries, they may not have the capacity to necessarily store it. But then what are you supposed to do? And you have to just be very careful. And I suppose ultimately this data belongs to patients, doesn't it? And I think that's the important thing to remember. One of the things I think that kind of goes hand in hand with that is that one of the really nice things that tech could try and do is make patient records actually linked to a patient, because it's probably the same in the US, but there's so many different EMR systems or other systems, and it all depends on which license you have and who's paid who money, and they don't all talk to each other. And that's probably one of the big frustrations. I think the only other challenge that I think is quite interesting is that some people just don't like technology. And we have to just be careful. I think, don't get me wrong, I think tech is great. We kind of in a sort of shared mindset here, but we just have to be careful. And I think Ali might have mentioned this, that we don't widen healthcare inequalities, because particularly the elderly, you know, they're going to be using all these apps. Well, maybe it's unlikely, isn't it? And similarly, people who don't have the money to get the latest iPhone or Android phone that you need in order to use XYZ app, or refugee, you know, people who are displaced. And I think we just, you know, some of these people are going to be the people who have the largest health requirements and health needs. We just have to be careful that we're not kind of providing more stuff for the worried well. And that comes with a healthy dose of cynicism, but I think it is also important to appreciate. I'd be interested to hear what everyone else thinks.
That's where you were talking there about the audience. So like tech is obviously where it's all going in the future. And I think sometimes, like you say, not to have an expectation that everyone's going to be using it. And for when I'm working with the blood donor app, and the team there, it's like, it's an amazing tool, and it's really efficient at getting appointments booked and being able to display this information to users about where their blood has gone and the health charts and all of that. But like to your point, there's people who are quite elderly, and also in the States where it's so big as well, like not everyone has access to some of the technologies that we want to be using and be able to talk to people. So you do need to make sure that you kind of got this omni-channel suite to kind of still cater. And when you're looking at your strategy for an app, you need to think, okay, what audience can this cater for? But where are my other audiences? And then what kind of either tech or human interaction or customer care, what is it that is going to make sure that they still feel like they can access that information as well? So I think it's a really good point, and it is still a challenge of making sure that you're not focusing all your efforts on one particular technology, because you are going to then hinder a part of your audience, and you do really need to consider those edge cases when you're looking at health and well-being.
There's an additional, I think there's a really good point, but there's an additional question on what are the key drivers. I mean, the key driver is being a cynicist, not generally to make everybody healthier and happier. It's generally to make more money and save money, and make people happier and healthier too, if you can. But I mean, that's not generally the declared goal. And so, if you look at EasyJet or any booking a ticket for an airline, my parents do this when. It's quite hard to do it any other way than doing it online, and it's hard to do anything other than check in online, and everything's become online. And if you're not used to that, e-banking is the same thing. It's hard to pay bills here at the post anymore. You can't. You have to do it online, or you get sanctioned financially. So you are pushed in a direction to do that, and there is. We always. I don't. We were speaking about the elderly for the last 30 or 40 years, but now the generation that becomes elderly has had cell phones and things for the last 20, 30 years as well, 20 years maybe. So that generation has grown up with it. But I think the problem is also the accessibility, visibility, vision. I mean, it's not only do I use tech, it's are the buttons big enough? Have I got a neuropathy? Can I maybe not use the phone? Can I not see the phone? I'm at the point where I take my glasses off to look at the phone, and if there's too much light outside, it's a bit of a challenge. But I can do it because I can regulate my phone. But you just start realizing that there are different abilities in different segments of the population. They may be academic, but they may also just be physical, that inhibit people from using these tools. And that's not something that everybody thinks about when they're developing a tool, right? So you might have the contrast isn't good. That is a big barrier for people.
Absolutely. And William,
Yeah,
do you have anything to know in terms of the? Sorry.
Yeah, I certainly do. I mean, in terms of being motivated by money, the Red Cross is anything but. But we have the same challenges of getting, we're trying to reach those hardest to reach people and using tech as the catch-all. I love the phrase, the worried well. I thought that was brilliant, Daniel. But how do we use our education to have that kind of share element, that kind of care element as well, so people with access to the tech then go on and use it to reach out to other people that maybe don't. And that's the challenge. But we still find some of our best education is face-to-face. Somebody in front of an Annie doll having a go is going to learn it far better than watching it on the screen. But it's a challenge. Any answers? Welcome.
We had an interesting experience though with our teams in Malawi and Zambia. That the ones initially we were sending out teams to train people on the ground how to use the app and how to work with the app, and our perception was that was going to be a lot better because you've got the personal interaction, you've got personal training, even though the app's not particularly hard to use. But it's still important. And what's quite interesting during COVID, of course, it wasn't possible to send anybody out to train people in the field. And so training was done remotely. But what was interesting in the statistics that I saw, a lot of the calls that have been coming in now are from areas that are remotely trained. So I found that really interesting to see that you have to adapt how you do things, but you can reach people. And if there's a lot of interest in the people you're training, then you'll still make a really big impact. And Daniel, you want to add anything to that? But I found that really interesting that it was still possible.
Yeah, no, I agree. I think it's... Sorry.
Go on, a couple of minutes and then we're kind of moving on to the
I was
next
just agreeing.
So much to think about.
I was just agreeing, yeah.
Okay, perfect. Yeah, so this has gone really, really quickly, but so much interesting thoughts and experience in this area. We do have one final question that perhaps we can kind of cover off individually quite quickly about kind of exciting innovation or trends emerging in this space, if we have a couple of thoughts on that. And in addition to that, someone has asked from the audience, Ariana, about your inspiration behind the Stigma app as well. So if you could perhaps kick us off with that, and then yeah, it'd be really great to hear about your thoughts on innovation at the moment.
Oh, I thought I was going to get out of the innovation question, just get the easy one, what I know myself. But so the short version is there's a TED Talk by a Nigerian author named Chimamanda Adichie that's called The Danger of a Single Story. And I reference it a lot in sharing my inspiration because it talks about how storytelling, yes, is powerful, but how many times it's told, by whom it's told, where it's told, when it's told, affects people's perception of things. So as a young person telling people that my father had schizophrenia, their reaction was always fear. And the reality is that most people hadn't encountered schizophrenia. They had only ever seen it on TV. And it was usually on a crime show like Law and Order that was fictionalized, or on the evening news. And so you can't really blame people for being afraid of a thing they don't understand. That's human nature. And then also only ever being exposed to a terrifying version of a label, you're going to think that everyone has that thing. So really my motivation and inspiration was, I want to, as someone who is a storyteller and a filmmaker, and I actually went to school for pre-med and I did not hack it. So to the doctors on the call, like, oh man, I'm just so impressed. But I leaned into what I was good at, which was storytelling. And I thought I can make a contribution this way and make people feel less alone, because they're going to see, we have a wide range of stories of autism in our app and online. And my son is autistic, and that, it's by design. We care about every label, but we have non-binary Latinas talking about, culturally coming from a place where there's a lot of emotion shown in your face and a lot of physical touch, and that not being comfortable. So telling a story about autism that isn't a white male is atypical. Telling a story about PTSD that isn't a combat veteran is atypical for what is being shown now, but not for the lived experience of humanity that's, navigating these things. So it really is about the power of storytelling and wanting people to feel like their unique lived experience of whatever labels they carry is unique to them, and it's deserves to be told. So that's the origin. Oh,
Amazing.
innovation.
Thank you.
I can't wait to hear what my colleagues on the panel have to say about innovation.
Yeah, let's hear it.
I can jump
Ali,
in
what's your
here.
thoughts on innovation at the moment?
I think Ariana touched on this already, but I feel like there's a huge trend towards personalization. So like, what are the unique experiences that we're having as individuals, and how can tech help meet and make sense of those experiences and help us navigate them better? AI insights, through algorithms, through communities and sharing, and lifting up those things, and just kind of creating awareness and acknowledging them, because that, I feel, hasn't happened so much before. And then in terms of other trends, I've seen, I think I already mentioned, like, you know, the ability to remotely work with doctors and patients, create that collaboration in a way that it wasn't happening before, whether it's through telemedicine and that phone call, or just like, you know, having doctors and patients have more accessible venues of communication, using apps and things like that, providing that ongoing support, leading into things like digital therapies, the VR headsets, the AR, things like that, to sort of assist in whatever kind of support that you're getting directly from your physician. Health-focused wearables, again, like the Fitbits, things like that, but, you know, the data can be shared with your practitioner, you know, really help inform your overall healthcare plan. And then just also, again, sort of like centering the use and increasing access, making sure that things continue to get more accessible. I know Dr. Widmer talked about sort of like more tech giants entering the space and doing it on the basis of profit. And I think there is this sort of Pareto principle in terms of like, we want to get the biggest bang for our effort. So like, what's the 20% of effort for the 80% off? How do we, you know, maybe start with that, but also continue to think about, you know, for those remaining 20% of folks who might not be tech savvy, or have regular internet access, or, you know, have all of their accessibility needs met. How do we continue to be aware of these things, lift these things, and center these things so that they stop being outliers and start being people that we generally consider as we're building things?
I'll just jump in there quick. I don't know if it's 80-20. I mean, if we're looking at the globe, it might be, percentages might be very different, but I thing that I'm excited about is we had a provider present the set of medical instruments they provide to patients to monitor chronic diseases, so that if you have a child with a chronic disease, you have your little remote stethoscope and everything else, and you can apply that to your child, and your physician can listen into everything and give you healthcare support. And I found that really brilliant from the perspective, if you've got a child, you don't have to take it to the hospital, there's not the whole displacement, there's less stress. I mean, that aspect of it, if it's an old patient or a patient that's maybe has dementia, or is just, there's less strain on the patient, there's less strain on the system. So I was very impressed by that. But I was also thinking of the thing I've talked about before, the lack of healthcare professionals. If you end up having somebody who's a clinician still active like Daniel, who's working with somebody who's maybe a nurse in an area, and that nurse can then use these tools and share the information, you're suddenly expanding the abilities that a healthcare professional has to reach potentially hundreds of patients just through using additional healthcare professionals that are well trained but don't have that level of experience. And I find the ability of us to provide more healthcare to people that way, not only in developed countries, but really in places where people don't have access, really very inspiring. And that's one of the things I was most excited about in recent times. And the second thing actually is that patients can now talk to each other and discover that they're not alone. Wherever they are, there's somebody else, and they can talk to people and share their experience like that. Ariane, you're very inspiring. And but having met patients who have gone online and I knew somebody who was bipolar about 25 years ago, and I remember, you know, the internet wasn't a big thing then, but he took me online. He said, look, I'm in this chat group and they're all over the world. And he said, type a question, type any question. And I typed questions and I got an immediate response. And this person said, I wouldn't worry about that. I have that too. And he said, this is really helpful for me because I go in there when I'm feeling lost or alone, or just, I don't want to talk about this with everybody because it's not a diagnosis that you want to talk about with everybody. But here in this space, I feel safe and heard. And that's, I mean, this is a very long time ago, this message, but it's come up again with Ariana's message. And but there's a huge power in that, the power of connecting people through tech. And they do feel together, even if they're not physically in the same space.
Amazing. Thank you so much. Thank you for sharing that. Really bringing communities together and connecting people to kind of share their experiences and stories is really great to hear. Emma, is there anything at Three-Sided Cube at the moment which is making you really excited that you can kind of like share with us?
I think it's just like there's obviously so much. Well, we've been talking a lot about AI and machine learning and like how we can triage better and quicker in emergencies, and particularly through like digital platforms and tools. That's always quite exciting, like to kind of get your head around. I think it's also just like, you know, also making sure that like thinking about different technologies as well. So everyone kind of might have an app, but like, how does an app talk to a web? How does a web talk to an Alexa skill? How can they kind of work together to help diagnose you? So it's just thinking about like the wide range of different technology tools that are out there and getting to work in sync with each other, and like making sure, like, you know, in terms of not when you do have an app, the type of information that you do share with that, if you're happy with like having it in that network, being able to like talk to an Alexa and go, hi, can you bring up this for my prescription? And it already connecting to another digital platform that you might originally have had that conversation on. So I think that's quite a interesting space to kind of keep an eye on in terms of like how the omni-channel of pieces like technology do work together to give you that fluid experience no matter where you are. So I think that's a really interesting one. And yeah, just machine learning really in terms of like, I mean, a big thing for me is just making sure that the regulation and how the regulation of that is working, and the use of users' data too. I think there's quite big conversations, and particularly when we work with clients around kind of health and wellbeing apps, is like, how are we going to protect the user's data? How secure is that user's data? And there's a big piece. It's not the most sexiest part of, you know, technology, but it's really, really important when it comes to this space that it's done right, and it is secure and a user feels safe using these tools. So I think there is a big piece about like, how do we make sure that the data is used in the right way, that we're giving a personalized experience to the user at the end of that technology, but it is very, very secure as well.
Yeah, absolutely. And I think that's the common theme that's come out of today, that we're in a very exciting time right now. The innovation is amazing, almost mind-boggling and blowing at the same time, but it has to be done with safeguards in place and ensuring that it's inclusive and accessible to everyone. Unless we have any final thoughts, I'd like to just thank everyone on the panel today. You've been really great. It's gone really quickly, and I'm sure we could have had much more bigger discussions about that. Hopefully we'll have a part 2 at some point. And thank you to the audience as well. We'll give a bit of a virtual clap to everyone taking part today. And thank you so much. You know, you guys will also be redirected to kind of Three-Sided Cube. We can hear more about our work, our experience with clients, what they're doing, what they're trying to change in this world, and which I hope you find more interesting. But thank you everyone today for your participation. Have a great day.